Hi, I'm Sarah Northcott. I'm a speech and language therapist and researcher, and this video is for healthcare staff. It's giving ideas of things we can all do to support the psychological well-being of people who've had a stroke and aphasia. So we made this video with people who are living with aphasia and family members, and it covers 4 things. So firstly, I'll give some background about aphasia, and then people who have aphasia and a family member share their experiences of interactions they had with healthcare staff that really supported their emotional recovery after the stroke. They then reflect on interactions with healthcare staff that they felt damaged their psychological well-being. And finally, we share 3 suggestions of small things that we can all do tomorrow that we believe could really make a difference. So aphasia is a language disability. Aphasia happens when the part of the brain that organises language is damaged, for example, after a stroke. And it can affect talking, understanding, reading, writing, but it doesn't affect intelligence. And it can vary from person to person, from a mild word finding difficulties to really severe problems finding any words at all. And aphasia is common, so around 1/3 of people who have a stroke will experience aphasia, and for many it's a lifelong condition. And it can be incredibly frustrating, knowing what you want to say but not being able to find the word. And rates of depression are high, between 43 to 70%. People with aphasia are 7.5 times more likely to experience symptoms of depression than people who've had a stroke but don't have aphasia. And depression is associated with worse rehabilitation and long-term outcomes. Aphasia can also be really isolating and really hard on family members too. But there are things that we can do as healthcare professionals that can really support people with the psychological impact of having a stroke and aphasia. So here are some of the things that people with aphasia have told us help.
I think my speech therapist, Kate, as well as learning sounds and doing speech therapy, building up words and these things, I was able to talk to her. It was almost like speech therapy and therapy, because I could talk to her about problems I had in the real world, if you like the real world, of meeting up with groups, interacting with people, you know, how you cope with people who finish your sentences for you, that sort of thing. If I had problems or anger or frustration, you could tell Kate about them.
The positive side, there was a nurse who was, she made my makeup, which was amazing, because I couldn't do it. And she was kind, definitely. In the beginning, I was crying so much. I didn't know what I was doing. But there was a consultant, Catherine, who was so kind, really. She and the consultants were so patient to me, definitely.
Once John was discharged from hospital, the assisted discharge team came to visit every day, and they were very nurturing. They always asked, "How are you doing?" Because John wouldn't answer the door, I'd be the one answering the door. And so at the beginning and the end of the visit, we'd always have a little chat about how things were for me. And I don't think I realised at the time why they were asking me, how was I? Because there was nothing wrong with me, my brain was fully intact. And I didn't realise quite how much strain everything had been, really. But hearing people say, "How are you?" like repeatedly in a way that kind of gives you permission not to be okay, because they're expecting you not to be okay, and so it's allowed to go, "Actually, I've had 2 ice buns today because it's a really difficult day." So yeah, that was very supportive when they were visiting at home.
There was a speech therapy in Charing Cross. She helped me. I couldn't speak at all, so she said, I'm married, and I said, baby? And she said, yes. And she was talking about life and everything. And it was just normal talking, like friends, if you see what I mean.
The nurses was good, yeah. They all, they always, good morning, or good day to you. I couldn't speak, but they was chatty with me, yeah. And all they jokes, lots of jokes, yeah. I didn't answer because I couldn't speak, yeah. But it was a good feeling, yeah.
Building relationships with people after they've had a stroke can be really difficult, because if they don't have any words, it's harder to get to know them. But I think by being yourself and talking, just treating, these are your patients, but they can also be people to enjoy spending time with. And by making conversation, even if you're just getting a facial expression back, then you can learn a lot about somebody, maybe with a bit of humour, maybe with a bit of like current affairs, just trying to make conversation and getting to know somebody. And if you do get to meet their family or their friends, then finding out more about them through that, and what makes them tick and what makes them work.
And there are also things that people with aphasia and their family members told us damaged their psychological well-being.
I was awake, and there was a nurse there, and she was quite rough, because she washed my body and it was rough. So, but I couldn't speak, so I couldn't tell anybody. It was like a foreign body. I kind of felt ashamed, you know.
When something like a stroke happens to you for the first time, or to your loved ones, you don't know the rules, you don't know what's expected, you don't know how to behave. And I think sometimes staff forget that, because there were several occasions when the only phrase I can find really is that I was told off. And there was one time when I'd just come in for visiting, and John was really, really upset, and he was in his wheelchair with his back to the door, and to get down to his level, I just sat on the bed, and I was trying to get out of him what was the matter. And a member of the staff walked past and then just stepped back and looked in the room and went, "Get off the bed." And I was just like, I'm being told off for sat on the bed, I'm not being asked if there's anything wrong. And another time, John's mum, she's very nurturing, and like a lot of people want to bring something to the hospital, and she'd brought boxes of juice with a straw, and I didn't know. I don't think I knew until meeting the researchers from City, I don't think, why liquids get thickened. I had not a clue, and it didn't even occur to me that just because his water in his cup got thickened, that he shouldn't be drinking through a straw with juice. It didn't occur to me. And again, a nurse just literally was like, "Get that straw away from him." And nobody likes being told off, it's not nice. But to have it done in such an abrupt way when, like, there's just an assumption that you know and that somebody's told you, whereas we really didn't know anything at all.
I was in my bed, and the doctor and about 5 junior doctors, and I couldn't engage with him, but if I could have done, I would have said, "Oi, doctor, I am here. Yeah. Good morning. How are you? Yeah. And how are you feeling? Yeah. Not there's talking about doctors, junior doctors. Yeah. They have left my room, and I want to say goodbye. See you again. Yeah, it's difficult. Yeah.
I think I just went into autopilot and just literally did what it took to get through every day and try and understand what was going on. And it's not easy because visiting times was like 2 till 4 and 6 till 8 or something. And so you don't see any of the medical staff. They do their ward rounds in the morning. And John couldn't tell me. His speech had completely gone. He couldn't tell me what had been said about him and his recovery and the prognosis and just what we could expect. The first hospital John was in, somebody had brought in a notebook, and the occupational therapists every day just wrote what they'd been doing with him. And so it might have taken them a minute, but it was worth like gold to me. So that was a real positive. The book wasn't used as much as it could have been. There was one time when I came in for afternoon visiting, and John, he was trying to tell me something, and he was trying to write in his book, and he was drawing pictures, and all I could get was that he was going to be electrocuted. And I was quite worried, really, because you think about like treatment in the 60s and we don't electrocute people anymore. And I went and found just somebody on the nurses station, and luckily I'd got somebody who knew what I was talking about, and it was a physio who said they were going to use electrical stimulation to make his leg muscles activate, and it was perfectly safe, and it was just a battery pack. But if they'd have written that in the book, me and John wouldn't have had the battle of that conversation, and I wouldn't have had that absolute fear, and she wouldn't have had the interruption.
And finally, sometimes didn't feel that they were treated like a human being. So with her permission, I'm going to share Yimin's story. So Yimin is a highly intelligent, sensitive, artistic person. She loves dancing, she loves her garden, she loves listening to Beethoven. She speaks 6 languages and worked as an interpreter before her stroke. When she first had her stroke, she couldn't speak at all, but she still had her emotions, and she could still understand and nod and shake her head. But she describes how she felt the doctors and nurses didn't treat her like a human being. They talked about her, they talked over her, but they didn't acknowledge her. She says she felt like a piece of meat, and that this was emotionally devastating. She says that the only person who was kind to her in hospital was a kitchen helper, and he used to come and bring her meals every day. And she describes how one day he started speaking to himself in Spanish, and she understood, and he was so excited, and he started chatting to her, and they laughed and shared emotions together. And she reflected, he was so humble, but he had a big heart, and he gave her the one thing she needed for her healing, which was warmth and human compassion. We suggest that there are 3 things that we can all do tomorrow that could make a difference. So firstly, meet the person, not the diagnosis. When we meet our patients, we can see them through the lens of their deficits, or we can meet the person and learn about what's important to them. Secondly, listen first before giving advice. So as healthcare professionals, we have expertise and knowledge, and it's our job to use this for the benefit of our patients. But sometimes our expert advice and our instructions can be heard as feeling told off or lectured or threatened or arrogance. So consider if it may help if we listen first and then see if we can reframe our advice as an empathetic suggestion or gentle explanation. And finally, celebrate our colleagues when they're kind to patients. Of course, it's important to be professional, but we mustn't use our professionalism as a cloak to distance ourselves from our patients. Our patients tell us they value it when we show warmth and seem to notice and care about them as people. And this doesn't necessarily need to take a lot of time. This can be smiling, making eye contact, our tone of voice, chatting to them about everyday things. So if you notice a colleague, whether it's a medical consultant or a hospital porter, being kind to a patient, compliment them. And if you're listening to all of this and thinking, I'm already doing a lot of this stuff, then celebrate yourself as well. And please don't underestimate how much difference you're already making to your patients. So to recap, here are the things that people have told us support their psychological well-being. Listening to the ups and downs, kindness and patience, noticing family members too, chatting to our patients as people, a friendly and warm manner, supporting people with aphasia to communicate. And I'm going to add in an extra one, keeping hope alive that there is life after stroke. And here's a recap of some of the things that people have told us damages psychological well-being. So a rough and uncaring manner, feeling told off, being talked about but not acknowledged, poor communication both with the person with aphasia and family members, and not feeling treated like a human being. And here are our 3 suggestions of small things that we can all do more of tomorrow. So meeting the person, not the diagnosis, listening first before giving advice, and celebrating our colleagues when they treat patients with kindness. We can't always fix things, we can't always take away the emotional distress, but we can show concern. Having a stroke and aphasia turns someone's world upside down. Together we can all support them with their psychological recovery.